Hello, and welcome to the History of True Crime. Today we are investigating the case of Charles Cullen. Charles Edmund Cullen was a nurse of 16 years. His career spread across many medical centers and hospitals around New Jersey. Born in New Jersey after his mother had emigrated from England, Cullen's mother was killed in a car accident during his senior year of high school. Cullen noted that he was devastated by the fact he had not immediately been informed of his mother's passing and that the hospital had chosen to cremate her body instead of releasing it to the family. Cullen's father had died when he was only 7 months old. After the death of his mother, he was raised by his siblings, being the youngest of 8. The following year, Charles dropped out of high school and joined the Navy, where he passed the basic tests and rigorous training and physical and psychological examinations required for submarine crews. Cullen served on the USS Woodrow Wilson and rose through the ranks of his crew, though after several incidents of being bullied by his crewmates and being found dressed in scrubs, gloves, and a mask at his station, he was placed in a lower pressure job on the ship. After several suicide attempts and multiple placements in the Navy psychiatric ward over a few years, Cullen was medically discharged. After his discharge, Cullen enrolled in nursing school, graduating in 1986 and beginning work in St. Barnabas Medical Center. In this time he met Adrienne, whom he would marry just a year later. After fathering 2 children, Cullen was divorced by his wife Adrienne only 7 years into their relationship due to what Adrienne has noted as increasingly odd and concerning behavior. She filed for a restraining order against Cullen in 1993, the same year as the divorce, due to her fear for the safety of herself and her children. Adrienne claims that Cullen had left his 2 daughters alone with a babysitter for over a week, burned his children's books, and even spiked people's drinks with lighter fluid. Cullen feigned innocence, stating that his wife was exaggerating these claims. During his time at St. Barnabas, Cullen was responsible for the death of dozens of patients at the hospital. Notable cases being the administration of a lethal dose of IV medication and several overdoses of insulin. It is suspected that Cullen was injecting IV bags with insulin, making this slow death nearly undetectable, and having the opportunity to shunt the blame away from himself, and other nurses would prep and administer the bags themselves. Investigations began in the hospital surrounding suspicion of contaminated IV bags. Cullen left St. Barnabas in 1992 before the investigation had been finalized. It was later determined that Cullen was likely responsible for the deaths during this time period. After leaving St. Barnabas, Cullen secured a job at Warren Hospital, where his methods became even more concerning. Cullen admitted to killing at least 3 elderly women with lethal doses of a medication called digoxin. He used to treat irregular heartbeats, made to slow the heart rate of patients, and is administered in small doses. It is one of the oldest and most regularly prescribed medications in the field, however can be lethal when used incorrectly or in large amounts, as Cullen quickly discovered. Other nurses noted that Cullen was an exceptional nurse, especially when it came to understanding medicine, and often relied on him to recommend and administer medications to patients across many of the medical centers that he worked at. After the divorce between Cullen and Adrienne, he moved to Phillipsburg and considered quitting nursing. However, the need to pay child support to his ex-wife forced him to continue working. During March 1993, Cullen faced trespassing charges after breaking into the home of a co-worker and her young son while they slept. He left without waking them, however began following the woman, stalking her until a police report was filed against him. The day after his arrest, Charles made another suicide attempt. Taking 2 months off from work, he was treated for depression in 2 psychiatric facilities, though this seemingly aided him very little, as he had attempted twice more before the year had ended. That September, a 91-year-old cancer patient at the hospital had reported that a nurse had injected her with a needle. The patient identified Cullen before passing away the following day. The son of the patient, feeling uneasy about the sudden death of his mother, reported this as an unnatural death. Cullen and several of his co-workers were made to take a lie detector test. Everyone passed. Cullen continued working at Warren Hospital until the following spring before moving on to the intensive care unit at Hunterdon Medical Center. Cullen remained at Hunterdon for 3 years. He claims that the first 2 years of his placement here did not involve causing any harm to patients, though the hospital records for this time period had conveniently been destroyed at the time of his arrest. During his 3rd and final year at Hunterdon, Cullen admits to causing the death of 5 patients in 1996, again with lethal doses of digoxin. Cullen found work at Morristown Memorial Hospital but was fired shortly after due to his performance. He then remained out of work for 6 months. During this time, he was briefly admitted to Warren Hospital and another psychiatric facility after seeking help with his depression. After this, Cullen gained work at another hospital, however was fired again shortly after due to allegations of delivering and administering medications to patients at unscheduled times. He was later seen entering a patient's room with syringes in his hand. This altercation left the patient with a broken arm. The only recorded death at this hospital was blamed on another nurse. It is not known why. After jumping from hospital to hospital in New Jersey and yet more patients that were seemingly on the mend never waking from the previous night's sleep, investigations were performed. Coroner's blood tests showing yet more patients with lethal doses of digoxin in the bloodstream. All investigations were inconclusive and Cullen escaped all suspicion. The national shortage of nurses ensured that Cullen could consistently find work, regardless of his noted mental health and psychiatric evaluations. Even in cases where Cullen had been dismissed due to his actions, hospitals were unwilling to take any other action against Cullen due to liability concerns. After joining Lehigh Valley Hospital, successfully murdering one patient and attempting to murder another, suspicions around Cullen began to rise. He later moved to St. Luke's Hospital, where these suspicions only grew. Non-valuable drugs were being stolen and the vials discarded in a hospital bin. With no street value and no use as recreational drugs, this theft was unusual. An investigation at St. Luke's resulted in Cullen's resignation. His co-workers took their suspicions to the district attorney, however the case was dropped due to a lack of evidence. In the September of 2002, Cullen began work at Somerset Medical Center. By the middle of 2003, Cullen was believed to have murdered 13 patients and attempted to take the life of another using the same tactic, injecting insulin, digoxin and epinephrine into the 4 bags of patients or forcefully administering lethal doses via injection. Suspicions against Cullen began to rise again when Somerset noticed that he was accessing the records and rooms of other nurses' patients. The medication dispenser system recorded each drug that was accessed by each employee. Cullen had noticed that this system was not entirely flawless and began taking medications and canceling the initial requests that had been made on the system. After a staff member had called the poison information and education system due to multiple suspicious overdoses, the hospital was informed that someone was attempting to kill patients. Contacting any authorities was delayed until October of 2003, allowing Cullen to kill 5 or more patients and make an attempt on another's life. In late October, another patient died due to low blood sugar, and at this point the New Jersey State Police were contacted. After several weeks, the investigation went ahead. Though Cullen had been fired on October 31st due to a discrepancy in his paperwork, Amy Luffrin, one of Cullen's co-workers and friends, came forward to the police after becoming concerned with Cullen's habits of accessing files and unnecessary medications. She aided investigators in collecting information and evidence against Cullen, leading to his arrest on December 12, 2003. Cullen was charged with 1 count of murder and 1 attempted murder. Cullen later admitted to the homicide detectives that he may have killed up to 40 patients during his career. However, the number of patients believed to have been killed due to Cullen's actions is in the 102nd. After his arrest, Cullen admitted his only motive was to stop his patients from suffering or being dehumanized, to help them pass peacefully. Though states that many of the murders he committed were impulsive and he struggles to remember who he had killed or why. Cullen is currently serving over 11 consecutive life sentences, pushing his release date to past 2410. If you enjoyed this episode of the History of True Crime, like and subscribe to see our other video. Do you have a true crime story you'd like to hear on our channel? Comment down below.